Good morning, everyone. My name is Jackson Friedman. I'm the Policy and Education Coordinator for BCNPHA, and I'll be your moderator today. I'd like to welcome you to this morning's webinar, Reducing Vulnerability to Isolation Among Seniors, presented by Jenny Konkin and Susan Moore. We'd like to acknowledge that this webinar is being delivered from various locations on the unceded traditional territories of the Coast Salish people, home of the Musqueam, Squamish, and Tsleil-Waututh nations. We acknowledge that many of you are currently located in the ancestral homelands of Indigenous peoples across the province, each with their own unique traditions and history. At this point, if you have any technical questions or issues, please visit the GoToWebinar support URL at support.goto.com/webinar. Before we begin, I'll give a brief outline of the format. The presentation will take approximately 45 minutes, and this will then be followed by an open question and answer period, for which we have allotted approximately 30 minutes. Our goal is to finish up by 11:15. During the session, please feel free to type in your questions at any time by using the chat feature. We'll then do our best to address all questions during the open Q&A segment. This webinar is being recorded and the audience will be muted, which means that you can hear us, but we won't be able to hear you. Again, please type your questions using the chat feature. A recording of this webinar will be sent out within a day or so, and you'll be able to access the PowerPoint there, so you don't have to worry if you missed something today. At the end of the session, we'll send a quick evaluation survey to everybody. Appreciate you. Before we start the presentation, I'd like to extend a big thank you to our BCNPHA education partners whose support has enabled online professional development opportunities for the community housing sector. I'd also like to acknowledge Lisa Edwards, who's participating in the webinar. Lisa is a consultant for getthepicture.ca and will be creating a virtual visual recording of the webinar, which will be sent out to all participants as well. We look forward to the visual summary with key points from our discussion. Now I'd like to introduce our presenters. Susan Moore has extensive experience developing collaborative programs in support of vulnerable and older adult populations, working in the areas of frontline service provision, asset-based community development, and nonprofit leadership. Susan is passionate about creating innovative, collaborative programs to build community capacity and bridge the gaps in support for vulnerable and at-risk seniors. Jenny Konkin is a public speaker, has been featured in national and international media publications such as the Vancouver Sun, the Providence, Breakfast Television, CKNW, the Huffington Post, and many more. She was also awarded a top spot on Business in Vancouver's Top 40 Under 40 2018 list and the Capilano University Alumni Awards of Excellence. She is co-founder and serves on the board of directors for Holway House Society, a board member for the Veterans Memorial Housing Society, and co-chairs the Business by the Book Committee. She also serves on the BC Housing Supportive Housing Leadership Forum. And I'll now turn the presentation over to Susan. Thanks very much.
Great, thank you. Now this is my first time trying with this media, so please forgive me if I get stuck in the technology. So today we're going to be discussing seniors isolation and specific to what it means to be living in nonprofit housing or supported housing. And specifically with isolation as it applies to the current COVID-19 situation. So top priority being safety. Before talking about the things that we need to implement in order to keep people safe, I think it's important to review what isolation does for vulnerable adults. Isolation in and of itself can be a primary barrier for seniors to access support. As you can see in the slide, and looking at it from a perspective of vulnerability to abuse, we see that it becomes a spiral down. As someone is experiencing isolation, they become more vulnerable to abuse, which puts them into more isolation, which makes them more vulnerable to abuse. And it continues to escalate that way. Within the context of other factors leading to isolation, we can look at things like shame as being an issue that can force people into self-isolation, poverty, a fear of asking for help or not knowing how to access some of the resources that exist within community. We also deal with some other health-based issues like physical disability, mobility issues, or mental health. So not everybody is able to access support that would get them out of isolation. They may already be dealing with a substantial amount of isolation prior to COVID-19, and this is even more profound now. When we look at abuse, we know that there is a pattern to it, and as someone is isolated, it becomes harder now for people to even be able to access support, or for others to become aware of the challenges that somebody is facing. And as housing providers, we have that opportunity to interrupt, not intervene, but interrupt some of the challenges that people face as a result of the isolation. And some risk around abuse, we can look at things like financial abuse, and how that is becoming predominant right now, especially when we're looking at things like scams that are taking place in the community. I think it's also important to remember that not every older adult who is isolated or alone is lonely or wants to change their level of isolation. So a lot of that is approaching the older adult as a competent individual who has the right to choose how they're going to live, even if it's continuing to live in isolation. Whoops, sorry. I'm just going to go back for a second. So here's an example of one of the scams that's going around. Those who do prey on the vulnerable are very good at what they do. So there's a lot of misinformation that's going out right now. A lot of capitalizing on the relief that's being promoted through our regular media. And there are people who are susceptible to believing what they see and clicking on a response and perhaps becoming victims. Some of the other things that are happening in community are things like the fake selling of fake COVID-19 home tests. And then we're also seeing an increase in the number of people who are the new best friend and helping or offering to help with grocery shopping and things like that, where they may take the older adult's bank card and go to the grocery store to pick up groceries, and then they just don't come back. Drain an account, take the cash, take the food, whatever it is that they're able to get away with. Whoops. Here, when we're looking at the safety of adults, older adults who are vulnerable to elder abuse as a result of COVID-19, I think this is a really effective diagram, and it shows where we in the housing sector are able to really have an impact, and that's within the yellow triangle with risk mitigation. We have that opportunity to know sort of a little bit more about what is normal. We also have a little bit more control over what's happening within the buildings. And so for older adults who are at increased vulnerability due to cognitive or physical decline, or who were already exposed to elder abuse, safety during COVID-19 isolation may be even more acute, necessitating support or intervention from experts like police, lawyers, medical practitioners, those subject matter experts that are available in community. So an example of that could be an older adult with dementia, maybe attending an adult daycare program, and that program has closed. So the caregiver no longer has respite support. What ends up happening is that those caregivers are then left having to provide complete support to their loved ones who may or may not be exhibiting aggression. And neither the caregiver nor the individual who's living with dementia is safe. They're both vulnerable to escalating incidences of abuse. And again, this is where we can sort of provide that additional support.
Hi, I'm Jenny. Thanks, Susan. That was really great. I'm going to talk a little bit about how do we provide safety during this time as it applies to COVID-19. But I quickly wanted to send out a poll just so we know who's here with us. I know both Susan and I are here in Vancouver, and we wanted to just see where the other members who are joining from across the province. So I think they'll be putting out a poll. There we go. And that'll just be up for a moment. So if you just want to click if you're from the Lower Mainland, the North, the Interior, or the Island, and then we'll just share the results of that as well, just so we know. And then also as we're taking questions, it'll give us a better idea of where we're all coming from. A little about me, I run Whole White House Society. So we provide community building programs and tenant support services in partnership with nonprofit housing providers. So we're funded through BC Housing. We come on site to the nonprofit housing provider as a partner and provide our services. And then I'm just waiting for this. Oh, there we go. Screen to come back. Okay. All right, so we have 59% coming from the Lower Mainland, nobody from the North, 18% are from the Interior, and 24% from the Island. So that's great. It's good just to know that we have people joining from different regions, and I'm sure a lot of the information that we provide does depend on the region that you're from. So if you have any questions that are specific to that, please feel free to type them in, and Jackson will help get those to us as well. So as I said, we provide community building programs, and when the pandemic hit, of course, we went to our pandemic plan, and that required us to make a decision to stop all non-essential services. Now, that meant no congregating. Our essential goal is to actually help seniors come out of isolation and build a really healthy community within their housing. So for us, in order to be able to help them with their safety, we were being asked as a country, as a nation, to self-isolate. And we've heard many times now, I'm sure you've heard the saying, we are all in the same storm, but we are not all in the same boat. And so this pandemic is very different for different people, depending on your socioeconomic situation, your mental health capacity, your different disabilities. And so we wanted to ensure that we were actually providing services that related to the residents we were supporting. So our first building is at the Veterans Manor, which is 133 senior men who have experienced homelessness or have come out of homelessness and are at risk of homelessness. So we needed to look first at what that meant for them. It's easy to say stay home, but for a low-income at-risk senior, that's nearly impossible if they don't have access to the essential services that they need. So for us, we had to pivot, and we had to pivot very quickly, as I'm sure most of you have had to do as well. So we had to decide, what do they need access to in order to be able to self-isolate? Immediately, I was able to think through, what boat are they in compared to what boat maybe I'm in or somebody else is in. For me, I have access to the internet, and so I can order something from Amazon, or I might be able to physically go to Costco and stand in long lineups and use my credit card to buy enough groceries for the next 2 weeks. That's not where they were at, and they wouldn't have access to those resources. So I'll be very honest, at 6 a.m. on a Sunday morning, I was laying in bed stressing about how are we going to help keep our seniors safe, because it seemed very pertinent to me that we acted quickly. Most of our residents who stand in a food lineup at a cafeteria in the drop-in center next door. So to me, I could visually see elderly people with multiple and complex health issues standing in a food lineup, which many of you may have residents who do the same, to access food. That meant they were around other people with complex health issues who might be coughing on them or touching surfaces or potentially spreading the virus. So my first point of action was to start a meal delivery program. For us, as I said, we work with BC Housing, so I reached out to BC Housing and asked, can we please start a meal delivery program so that they are actually able to self-isolate, which is what we're being asked to do. And they responded very quickly and allowed us to start a meal delivery program. The other thing that they really needed access to was their medical services. So with our tenant support services, we are in contact constantly with their clinics, their doctors, and we don't do any medical services, but we will help coordinate their medical services. So many of our residents have been able to do their appointments virtually. Something as simple as an iPhone that you or I might carry in our pocket, they don't have access to. So we were able to be their iPhone and do virtual medical appointments that way. But really, we wanted to look at how can we set up different systems for different people based on what their needs are, so that we can try to avoid having them standing in clinic lineups and keeping them home as much as possible. And then, of course, their finances. So helping them with banking assistance, whether it was us going to the bank for them, setting up with their landlord, how can we pay their rent for them and help keep their finances in order so that they weren't falling behind. And of course, with the additional services for social assistance as well, or additional finances, just helping people understand that and manage that so that they knew what they had access to as well. And then appropriate information from trusted resources. I don't know if any of you had the same experience, but we started to hear the conspiracy theories come out guns a-blazing. So we heard things from the government has put this to the downtown east side to kill all the homeless people, to they're giving us free meals so that they can poison us. All different kinds of conspiracy theories. We've all heard them. They go around the internet. Even from the news, it's easy to pull different theories. So we wanted to ensure that we were giving really clear and concise information that actually was pertinent to their lives and relatable. So that's how we responded. We've now actually been able to replicate our program with a knock and drop system and I think you can go to my next slide, Susan. So we started, so at the Veterans Center, we do door-to-door meal delivery service twice a day. It would look like what you would see in a hospital with a tray of food. And so that, because they are very, quite frail and have very complex health issues. We also partnered with Affordable Housing Society, New Chelsea Society, Vancouver Native Housing, and Union Gospel Mission, who all have low-income housing, high level of seniors, as well as at-risk individuals. So with them, we had to think through every step of the way. Are we keeping them safe? Is what we're doing helping or is it hurting? And so we started a knock and drop system where people could sign up for our free meal delivery program. And as you can see in this photo, we knock on the senior's door, we leave the bag with the meals in it at the door and we step away so that we're ensuring distancing. We use PPE and we work together with the building manager as well. So that we have minimal contact coming into the building, we do 2 drops per week of their meals. So this worked really well as well. So we are now in 13 buildings and we've done about 12,000 meals to date, starting March 17th. So, and then the next slide. Thanks, Susan. So these are our partners here. We've added New Chelsea as well. Our meal providers have been restaurants that supported us in the past that we've worked with for many, many years. So the Dirty Apron, as well as Kitchen Table Group, and they provide the meals for us, and that's funded through BC Housing. If anybody doesn't know, BC Housing does have a program out there. If you have residents who are very vulnerable and need a meal delivery service, you are able to request through your BC Housing rep for meal delivery service. And they can either orchestrate it for you or you can find your own meal provider. And that's something that we've been able to replicate for multiple organizations. Thanks, Susan.
Great. So we're going to talk a little bit about some of the top barriers for safety or to safety for seniors. And there are a number of barriers. We certainly don't have a fully comprehensive list, but some of these are really pertinent to those who are living within social housing. Isolation. And isolation takes the form of everything from geographic barriers, physical barriers, self-isolation to language, abuse, as we mentioned before, and even some of the familial separation. We know that there are a lot of people whose families are living someplace else and they're not able to have that regular contact with people. Poverty is another barrier to safety. Not everybody can afford food. Not everybody can afford a phone. So if you're not eating and you can't reach out for help, that's a real challenge. Some of the services that are provided in community that are supposed to be available to everyone have really long wait lists. And for those who are living in poverty, of course, they can't afford to get private support in. So somebody who may be caregiving for another or requiring support in maintaining the cleanliness of their suite, unless it's provided through the public sector or the nonprofit sector, they're not able to get that level of support. Health, again, is another one of those barriers to safety. Mental health being a challenge. If someone's non-compliant with their medications, they can be living at greater risk than if they were compliant with medications. Mobility is a challenge. If somebody isn't able to get out of the house safely, or to be able to do things like get groceries or take out garbage, they're living at greater risk for things like, well, if you can't get food, that's a big challenge. But if you can't take out your garbage, you're also risking your tenancy. And physical health continues to be a barrier for seniors to be able to get support. And then there's shame. When I was working on the front lines with a senior serving nonprofit organization, more often than not, we were seeing seniors who were vulnerable, who were living at risk, and they weren't asking for support until they had exhausted every other possible option, from selling everything that they owned, going through all of their savings, borrowing money, doing whatever they needed to do, and they were too embarrassed to come out and ask for help before it was like last minute. For a lot of people too, they don't know what services may exist. They've never accessed the system. And now more than ever, people really need that support. But it can be a real challenge to ask for that help.
So I kind of just spoke a little bit about this. I might have gotten ahead of myself, but I want to talk a little bit about those top barriers and then how do we address them. So I think we all kind of know the problems, but some of the things to look out for, as Susan and I just mentioned, money. So you can't stock up on essential items if you don't have enough money to do that, or a vehicle, or things like that that would allow you to stock up. Standing in food lineups, of course, and even in the lineups at Costco. I've only been to Costco once since this began, and I couldn't believe the amount of seniors that I saw who were there. So just trying to help seniors avoid being in those lineups as they are the most vulnerable to the virus. There's so much information out there that this can be such a barrier for them accessing help. It's quite scary if I'm getting a lot of information that I don't understand or that is conflicting. So for us, we wanted to really look at what is actually true and what is actually applicable. One of the biggest things that we heard when we began offering the meal delivery service was, no, it's okay, I'm not sick, I don't need it. But helping them to understand this is actually preventative. We want to prevent you from getting sick, and the best way to do that is through isolation. So what kind of messaging were we getting out there, and how did we present that information in a way that was actually well received? And then support. So if there's no one there to help with virtual appointments, then they won't have access to those doctor's appointments unless they go in. So again, putting themselves at risk. They don't have any close family or friends that are safe. Some people do have outside relationships that Susan was speaking about. They could be vulnerable to new friends who all of a sudden are helping them. And we're very cognizant of that because it can often seem like a great gift. However, that person may have malintentions, even a family member. And sometimes they don't know who to ask. So there's definitely a level of trust that is needed in order to address these barriers. And I'll go into that in my next section. But I'll just show you a little bit about the next slide. Sorry, Susan. Just a little visual about some of the seniors that we are serving, and how when we rolled out the meal delivery program, it really took that level of relationship to help them to understand the why behind it. And I think that was our number one way to implement anything to help people, is to help them understand why. Because as I said before, we were hearing, well, why are the meals free? It must be because the government's trying to poison us or give us coronavirus. And so we really had to help explain the why behind it. And for us, having already worked in the building, we were able to use our relationship where we had already built trust with them, that they knew our sole intention was to help. So as a landlord, you may even have that relationship with them where you're able to explain the reasoning of why we're trying to help people self-isolate.
Great. So some of the resources that exist in community have really escalated the level of support that they're able to provide and increased the number of people that they're able to provide support to. So I want to talk a little bit about some of the key resources that individuals can access, as well as we, working with those who are vulnerable, are able to help provide support in connecting seniors to the resources. So the Seniors Abuse and Information Line is run by Seniors First. It's a nonprofit and it's available throughout the province of BC. They are a nonprofit organization that is staffed largely by lawyers and social workers, and they do an amazing job of being able to provide vetted, valid information regarding anything from tenancy through to how to provide support to someone that you're concerned for. In some cases, they will even take on cases when there are concerns around abuse, neglect, or self-neglect. Everything is free through them, and they also offer translation services. So there are limited hours in terms of when they're able to provide the language translation, but generally speaking, if you need support in being able to get information to a person in their first language, this line will be a great help for you. REACT is a program that's offered through the Health Authority, Vancouver Coastal Health and Providence Health. I'm sorry, I don't know if it operates in the other health authorities, but its whole purpose is to investigate and mitigate concerns around abuse and neglect. One of the great things about this number and this resource within the Health Authority is that once you report a concern, they have to investigate. The challenge is that you won't necessarily know what type of resolution has been made or what the results are of the investigation. So it can be a little bit frustrating for people who are trying to refer those who they are concerned about to this support service. But it's important to remember that they are mandated to investigate, and they do. You are able to call on behalf of an individual that you're concerned for. People can also self-refer. And then, of course, there's BC 211. There's been a lot of media recently regarding BC 211 in terms of being able to help direct people to sort of the escalated Better at Home programs. It's a fantastic resource, like all of us in the nonprofit sector and in social service sector specifically. This is very new in terms of the amount of need that's coming in and the variety of need. What BC 211 has done has been incredible, and they're referring individuals back to the appropriate service providers in the communities where individuals live. They're also helping with matching volunteers to organizations or to services that are being provided. So there's a lot of coordination that's happening, and they're a great resource also for us as providers, because they're also tracking a lot of data, and we'll have access to those stats and the information that they're asking for from those people who are wanting to access resources or who are calling for help.
So one of the first things that we had to learn how to do was, how do we educate our seniors so that they can take this in and make a decision for themselves. It was really important, as I said, to try to get rid of the noise in all the news and the conspiracy theories and the gossip, and provide accurate information. So I don't know if you guys felt like your buildings got covered with signage, how to wash your hands, how to stay 2 meters apart, and all of this. And we realized, as for anyone, it gets overwhelming. And once it's overwhelming, you stop paying attention. And so we had to really carefully select the information that was applicable to our seniors. Something that might be applicable to me, a single working person, might not be applicable to them. So we didn't want to waste space, mentally, visually, physically, with things that didn't matter. And so we carefully selected the most important information that would matter to them in that specific building. And again, this differed from building to building as well. The seniors at the Veterans Manor are much less mobile. The goal was to keep them inside as much as possible, whereas at other buildings, we had seniors who were still getting out of it, still going for walks, doing things like that. So the information was different. We wanted to use language, first of all, that doesn't spread fear, that would be taken seriously, but would spread education versus fear, empowerment, how to do this and how to ask for help if you need it. And so we definitely use language instead of saying, don't do this. It would, we turn that around to thank you so much for washing your hands when you enter the building, or thank you for not using the kitchen at this time, versus everything being extremely negative and extremely oppressive. That's what we were finding. A lot of the signage comes off as oppressive. And one of the most common things that we were hearing from our seniors, and understanding cultural backgrounds, was that we were trying to take away their freedom. And so we wanted them to understand, actually, we don't want to take away your freedom. We want to ensure that you keep your freedom. And this is the way to do that so that we're not getting sick. And so by just simply switching our language, as you can make the decision to wash your hands, and we thank you for that. We appreciate it because it also helps your neighbors, including perspective. Like I said, we kept hearing, I'm not sick. And so helping also them to think about their neighbors around them. You may have a neighbor who has asthma or who has emphysema, COPD, and this will really help keep our buildings safe and clean. So including information that was compact, clear, but also compassionate. We all have empathy and we can think about others as well. So helping, just as we've been asked as society to do this, to help us as a society, we wanted to bring that down to a macro level, a micro level into our building. So how can we say that this is not just about you, it's not just about me, but it's actually about us as a collective in our building, that we want to help protect our neighbors. And that actually translated very well in our buildings, because they felt a sense of community and belonging. And this we're all in this together might not feel very real for someone living in poverty in the downtown east side in a building where they might feel alone. But once we were able to say, we, as in us in this building, are in this together, they could connect to that. That was something that was real to them, versus somebody on the news who they have no relatability to, or some person that they might be like, well, those wealthy people, or those people over there, or those people in that area don't connect to me. So we wanted to make it very relatable to them so that they could actually have buy-in. And again, we wanted to get rid of all the convoluted stuff. There was so much information coming out that, again, politics and all the rest of it, how can we keep each other and ourselves safe? And that was really important to us. We wanted to make sure that it was helpful and not hurtful. If information causes fear, we saw people do not respond well in fear. They do inappropriate things like stocking up on toilet paper. So if we're able to give information that is well received, that is relatable, and that is clear, this is more helpful, and spreading fear is more hurtful. And so that's what we really focused on, and we just needed to make sure that it was applicable to the people who lived in that building, because if we were giving them information that didn't matter to them, then they actually ignored everything else that we said. So we wanted to ensure that every single sign that we put up mattered, and we weren't wasting any space. And then we also changed our signage regularly, because just like everybody else, we get bored of seeing the same thing, we stop looking at it. So we just make sure we use colors. We also use images. A lot of our seniors struggle with their vision, so just making it really clear, so that even if you struggle with your vision, you might be able to see a picture of what that was about.
I don't expect you to read all of this. I wanted to provide a general overview of what some of the community-based senior serving organizations are doing to help seniors in the community. And these are resources that you're able to tap into, or that your residents are able to tap into. So an example is with the Seniors Come Share Society that's based in Surrey, White Rock, and providing support through Delta and Langley as well. So some of the things that they did immediately to be able to respond to the crisis as it was unfolding were things like increasing the friendly caller program or the telephone reassurance calls as they're shown here. They also started working to escalate the amount of support that they were providing through Better at Home. So contracting with a caterer to be able to prepare meals that were frozen and then delivering those to community members at no cost, but by donation. There's also another program that's launching, and I think it's the first one in Western Canada, but it's a model that has been used throughout the United States and in Eastern Canada, and it's a senior center without walls. So it's a telephone-based program that's educational, entertaining, informative. It's a program that's all run through the phone. And the person who's running the program does everything, including calling out to those who have registered for the program. It's a low barrier social type of program. You can get more information about what the Seniors Come Share Society is doing with the Senior Center Without Walls. They're receiving a lot of support from the City of Surrey, and it's a great example of innovation that is meeting the needs of those folks who have multiple barriers, from technology to just even being able to reach out and connect, to be able to remember to dial in or attend a meeting. Some of the things that we can also do to provide support to the seniors that are in our communities is, again, sharing information and resources and focusing on what is available rather than what isn't available. So building on what Jenny has already said about, trying to stay positive and not create additional fear. We want to build hope and to create an opportunity for people to see where there are opportunities beyond the restrictions as they exist right now. We're all trying to navigate a lot of unknown territory right now, and we're hitting glitches. We're all in a learning process. And so being able to let people know as we're referring them to programs or support services that things may not go exactly as we think they should or could be going. So helping people to measure their expectations of what the service provider or what the resources are going to be able to provide is really helpful. Setting false expectations can be devastating for someone who's already struggling with the challenges that they're facing. And I think one of the things that we need to remember is that it's hard for people who are isolated to understand that they are not alone in the experience. When you don't have regular contact with others, it's easy to think that you are the only person who is suffering or struggling or is having a challenge with being able to get groceries or whatever. Being heard can often help a person just work through those fears that they may be experiencing, or that sense of isolation. To be able to scream at the wind in the company of others often helps people to work through the crisis that they're experiencing, or at least help to diffuse some of the fear around it. So again, BC 211 is another one of the, I can't say enough about it right now, because that's one of the resources that we can give to people so that they can reach out and ask questions, that we can provide support to our seniors in reaching out to get information. Again, they also provide translation services. They're staffed by social workers, very well trained. They have access to a lot of information, and you can still go online to their website and get a lot of information and access resources that they're providing. Again, as it relates to the Better at Home program, I know a lot of communities experience quite long wait times in order for people to be able to get support through Better at Home. The United Way has done an excellent job in removing those barriers and working collaboratively with 211 in order to streamline that process. So things like co-pays right now, where the income testing had been in place, that's been suspended. So you can get support for free right now. We don't want people handling money, right? There is other funding that's come out to the Better at Home service providers, which means they've been able to expand the scope of service. They've also been able to expand how many people they're providing support to. So everything from meal provision to medical accompaniment to lawn care, pet care. There's a real breadth of services that didn't necessarily exist before. And here's another opportunity. How do we communicate effectively? How? For folks who are facing multiple barriers, for folks who are maybe already struggling with the concept of asking for help or being able to retain information, we may need to provide a little bit more in terms of not just giving them the resources, but providing additional support on how to access those resources. So it may be making the call on their behalf. It may be providing those reminders. It's really looking at what is the capacity of the individual and how do we then support. And I don't mean this to sound like an onerous task for you. I have no doubt that, like most of the service providers right now, you're probably doing absolutely everything that you possibly can and to the max. But this could be the difference between someone actually being able to get the help that they need or simply falling through the cracks again. And I think it's important to remember that people are good at dealing with what they know. It's so much harder to deal with those things that we don't know.
That was really good, Susan. I agree that the how part is the missing link often in this situation. So this is what I'm really passionate about. My entire organization is built on this. How do we spread hope? Because without hope, I just think food is not enough. That's not going to get us through life. And so this is really about our quality of life. This is about letting people know that we're there for them. And like Susan said, setting appropriate expectations, because disappointment can often really break that trust that you've started to build. But letting people know what we are able to do. Look at the positive things that we can do. I know it's difficult for the things that we can't, but what can we do to really stay connected with our tenants, our residents, our clients, so that they know that they do have somebody who's in this with them, who is willing to walk beside them, and when they need help, they can reach out. And we're here and we're listening, and we want to be here. We don't have all the answers, but we want you to know there is hope. This isn't forever, and we're all walking through this together. And so for us, that was a really important level, was to have their buy-in, because without their buy-in, we, at the beginning, you know, they were still going in and out all the time. And if you work in the downtown east side, you know that the distancing has been extremely difficult. We've been trying to take different measures, provide all the respite spaces have been closed. So there are way more people on the street. So I would have a resident walking out with his walker or coming out on a scooter and can barely get down the sidewalk because the sidewalks are so full of people. And so for us, in order to get their buy-in, not only for the purpose of safety, but also for their own hope, understanding I play a role in this, I'm a part of this. And so for us, we started to get creative. How we may not be able to do, we normally have games nights every week, or we normally have, you know, a morning coffee program where we all come together and have coffee or a smoothie. We weren't able to do those social programs, but we wanted to always give them something to let them know we are still connected. Even as we do the knock and drop meal delivery service, we always stay in the hallway to say hi. And I don't know if any of you have perfected your smiles, but smiling with your eyes because we're wearing masks, but you're still able to show I care, I'm here. Please let me know if you have any questions. Is there something you need help with? And one thing that has really stood out to me, especially, is to think about people who may have a language barrier, because as much information is coming at them, most of it is coming at them in English. And so if someone is an immigrant or doesn't speak English well, it's even scarier because a lot is going on around them that they may not understand where all these changes are coming from, or they're getting small pieces of information. And so just for me personally, I was dropping off a meal in a building close by here in the downtown east side, and the lady came out and she didn't speak any English. I believe she spoke Russian, and she just had tears in her eyes, and I could just see that she had been afraid. And so this meal delivery was like a lifeline for her. Like somebody reached out to let her know that she cared. And essentially, I mean, her landlord had partnered with us to ensure that the residents were getting meals. But it was more than the meal. It was really about that connection to say, we're here and we care. So sometimes we bring soap with us, we bring different resources with us, but to make things fun and social again, and to keep their hopes up, to keep their spirits up, which we all need, we started doing weekly trivia prizes. So my favorite trivia that we've done so far is just, what's your favorite band? And then you're entered to win a prize, and everyone can play. Everyone can tell us their favorite music. We did a campaign called Succulents for Seniors, so we raised funds to buy succulents, and we asked all of our seniors, you know, you can name your succulent and you can watch it grow. And so every week we check in, how's your plant growing? And like, oh yeah, a little arm is growing off now. And you know, those simple things, it's something really to focus on and something to help us know that there's growth and there's hope for the future as well. And then we did a Notes of Hope campaign. And actually, would you go to my next slide, Susan? I think I have a couple photos of these. They're the succulents. So we gave out succulents to all of our residents, and it was just such a joyful moment. And some people didn't want them, and that was okay. And others were really excited to have a plant to take care of. So that was great. And then on the next slide, this is our Notes of Hope campaign. And so we just reached out to our supporters in our newsletter and on our social media and asked people to send in Notes of Hope. A lot of people have been asking, how can we help? We're very limited on the amount of volunteers that come in. Most of our volunteers just help with the meal packing to decrease the interaction with the seniors. But this was a way that people could get involved, that they could feel like they were helping, but also what a gift to the senior. When we've done this in the past, seniors have been like, somebody made this for me. And so we asked for all of our Notes of Hope to be handmade. A lot of kids have been sending them in. I think parents are going crazy with their children at home. So this was a great little art project, but also to teach your child how to, you know, give back and how to reach out to somebody, and even how to think about seniors and where they might be who have paved the way before us. So we've seen great success with this. It's been really meaningful. And so these are some just little ideas. I'm sure you have great ideas of things you could do in your buildings. And I'm happy to hear some of those ideas or share more ideas if you have any questions about that. So I think back to you, Susan, or is that off to the questions? There we go. And there's my contact information. I'm happy to help in any way that I can. Also, if you go onto our website on the homepage, you'll see a 1-minute video clip of our mail delivery program, just to give you a bit of a visual in there as well. And I think Rachel is adding that to the chat there. So there's a link directly to the 1-minute video if you're interested at all to see what the meal delivery looks like, and if it's something maybe you could do in your building as well.
And this is my contact information. I just started with Brightside Community Homes Foundation. So please feel free to reach out. If there's anything I can do to be of support, my experience has been really in the provision of services to seniors and looking at community development and asset-based community development. Looking for opportunities to be able to collaborate and to support colleagues and other organizations in being able to serve their senior population.
Well,
And
thank you so much to Jenny and Susan. That was a really excellent, really informative presentation, and that was really great to just be here and listen to. We do have a couple of questions, not too many from the Q&A, so we may sneak out a little early, to be determined. But I'll go through and ask them here now, and then I'll do a little kind of thank you again at the end. The first question we've got here is if there's an info sheet that's been prepared that kind of contains all these resources that are being dropped off or could be dropped off at the doors of vulnerable seniors, or where somebody could find something like that.
That's a great question.
Yeah, and I'm happy to address that. Most organizations have their brochures available for distribution through other organizations. So if you contact 211, for example, they'll be able to provide you with the promotional information. So fridge magnets, for example, same with like the Seniors First. So they have different types of promotional pieces that are really accessible to those who you're wanting to share them with. And a lot of those organizations also have their materials printed in multiple languages. I believe this slide deck will be available for you to review. And you're always welcome to contact me directly. I'm happy to share resources with you specifically on how to get support for your residents.
It's a great idea, though, if there was an option to have a little booklet that shows all of the different resources that are specific to seniors.
Mm-hmm. A lot of it is geography that, so geographically specific, and that's where 211 is a brilliant resource. You can go online and see where those resources exist based on the community where you're located.
I think that actually gets to the second question we have a little bit here too. Maybe we can just reiterate that a little, and that is that how does BC 211 work for rural communities and rural areas, and are they kind of tapped into local resources as well as they be in a place like the
I'm sorry, are you able to say that again?
Sure, yeah, I heard a little feedback there. Hopefully that's fixed now. Does BC 211 work as well for rural areas, and are they tapped into local resources?
Yes. My understanding of BC 211 is that it's available throughout the province, and they're doing a lot of work specifically with rural communities. And it's in partnership with the United Way. And I think actually 211 is a part of the United Way. So they're able to direct to resources that exist. So for example, my mom lives in Cranbrook, and 211 can help me find information for my mom so that she's able to access resources there. In some of the more rural and remote communities, the accessibility will depend on whether or not people are able to get, like, Wi-Fi, for example. Not every community has access to Wi-Fi, so they're relying on telephone. But they can certainly answer that question as well.
Great, thank you, Susan. One more question here, maybe a couple more. This one's really interesting. And do you think we need to revamp our seniors' care, considering the overwhelming numbers of seniors that are passing away and struggling from this virus in long-term care facilities? Is there kind of a different approach we're going to have to take after COVID-19?
I would say undoubtedly yes. I think there's a few different things. I don't work in seniors' homes, like long-term care, but I think after this, I was just speaking about this with someone yesterday, asking if we felt it was too harsh that people weren't allowed to see their relatives and things like that. And I think there are creative ways in the future that hopefully we can set up preemptively, like having teen zones or areas that people can still see family members. We've all heard heartbreaking stories of people passing away and their family wasn't able to see them. And so I believe they'll come up with some solutions around that. And I think that'll be important for all of us who do work with seniors to have these plans in place if something like this were to happen again, or even how to prevent illness from coming into our buildings.
I have some pretty strong opinions on that question. I think it's a fabulous question, and it certainly speaks to how we as a society look at our senior population or vulnerable demographics in general. There were challenges and a lack of resources before COVID-19. I think COVID-19 has really put a spotlight on what was happening for seniors already, and especially low-income seniors. If we look at the province of British Columbia, we know that 50% of seniors live on $24,000 a year or less. And of those, it's, I think, 30% live on $19,000 a year or less. And I think it comes down to a fundamental question: who do we value? Who do we value in our society? And I think as a society, we've done a really poor job of really caring for those with the greatest need. Part of that is our political system. We're living in a neoliberal system where austerity measures were put in place so that services, health services in particular, that were once provided through the public sector were transferred onto the private sector or to the nonprofit sector. But for those of us in the nonprofit sector, we certainly didn't have adequate resources to meet the needs, either in terms of our knowledge base or our human resources, let alone actual financial resources to meet the needs of those with the most complex challenges. And there is so much need in our community. I think now we have that opportunity to really take a good hard look at what do we value and hold those that we're electing into positions of authority to be accountable for the decisions that are being made.
Yeah. That's a great point, Susan. And I think what we've recognized is, so I mentioned all the organizations we're now working with, including Affordable Housing and Vancouver Native Housing and New Chelsea Society. And these are all organizations that have been wanting our support services for a number of years now. And there wasn't a funding stream yet created for seniors specific supportive housing. Right now there's independent housing, supportive housing, which is general population, any age, and then assisted living and long-term care. And so most of our seniors, what we're finding right now, are falling in between the cracks of independent housing and assisted living. Just need some support services. So the primary example of this was at the Veterans Manor. Within under 48 hours, we were able to have a food delivery service up and running. Under 48 hours. So we had 100 seniors receiving meals in under 48 hours, done, ready to go out the door. For other buildings who didn't already have our services on site and a level of trust built with the residents, we're in week 8 now, we're still starting new buildings. So the proactive way of seniors housing is to have support services on site so that you already have a trusting relationship and you already have access to community programs, to support services, so that seniors aren't falling through the cracks. And especially when something like this hits, they already have those wraparound services ready to go. And when they're the most vulnerable, and like you said, Susan, often the least heard and the least valued in our community. Which is unfortunate, because I would credit a lot of what we have today to the seniors who came before us and have paved the way for us. So I think Susan and I have been preaching this for a couple of years, or a number of years now, because it's just an area where I guess they weren't the squeakiest wheel. And so it's on us, I think, as housing providers, as support workers, as caregivers to seniors, for us to these issues. And I think you're right, now the seniors are in the limelight, and I hope that this will change things for the future.
That was a motivational answer from both of you. Thank you. That was awesome. Just a few more here. Of course, as soon as I say we don't have too many questions, people start flowing in with the questions. So we've got a couple of more. One of them is, let me just find the right ones here. This is a little bit more kind of practical. Susan, Jenny, who provides the meals for the meal delivery service, and is this available to all seniors regardless of where they live?
So for us, because we are funded through BC Housing through COVID-19 has put it out to their housing partners that if you have residents who need a meal delivery service, you can go directly onto their link on the website and request. So it's the same place where we're requesting our PPE or different things that we're needing. You can request meal service for vulnerable seniors and vulnerable residents. And for us, so we're contracted in through those housing providers, so you're welcome to reach out to me as well, and I can share with you how we do that. But basically, we are the middleman, so we do the delivery service and we contract the food provider. So at the Veterans Manor, they already had a food provider on site, which was Aramark, who did the cafeteria. So we just get the food from there, which is what they were already used to eating. We didn't want to disrupt that in their lives. For the other buildings that we go to, we use the Dirty Apron and we use Kitchen Table Restaurant Group, who operate in Gastown, just because we already had a relationship with them and they've already supported Holway House for many, many years. But I also know Potluck Cafe has a program right now. So if you're not a part of BC Housing and you're in Vancouver, there's we're kind of a task force in the downtown east side, and they are providing meals to city-owned buildings, private SROs, and so Naveed over at Potluck Cafe is leading that. Some of the meals come through VCC. And then for more rural areas, again, it's the funding piece. So if you're with BC Housing, I would say that you can go directly to your representative and say, I have 80 residents who are not able to self-isolate because they don't have food. And so they'll let you know, and then you can request. So most of our buildings request 1 meal per day. So we provide 1 entree meal per day, and then most of them have other, whatever they have for their breakfast and things. But you can request that through your BC Housing provider. If you're not a BC Housing funded building, then I'm not sure, other than the city of Vancouver is providing meals for some of the buildings. So that goes to that. You can go to Potluck Cafe and find out more about that program. Do you know any more, Susan?
Yeah, again, through 211, tenants or residents can be referred to the Better at Home service provider or other community-based providers that are doing meal delivery.
And for us, it was really important. So all of our staff have been trained. I do weekly training with Vancouver Coastal Health so that we aren't actually creating more of a problem by coming into their buildings. So all of my staff have been trained in PPE use, in all of our distancing, so that when we are dropping off meals, we aren't actually bringing booze into the building.
Right. Thank you both. 1 or 2 more. I think we've still got a couple of minutes left in the webinar here. Is there an opportunity to create kind of a new sector of senior housing between independent and assisted, kind of like supported living, to bridge that divide? What impact could that have?
Yeah, that's what Holway House has been trying to do for the past 3 years. We were able to create that at the Veterans Manor. So the landlord is the landlord. We come on site as the service provider, which creates a supportive seniors housing model. So again, we don't do medical services. If somebody needs home support, we are the person who sends the email or makes the phone call to Vancouver Coastal Health or whoever their case manager is and says, can you please come and do an assessment for Mr. So-and-so? We've noticed he's not able to care for his hygiene anymore, or these are other issues that are putting him at risk of his tenancy, or health issues for himself. Even because we're on site doing community building programs, we get to know the residents very well. So we start to notice if they're struggling with their memory, maybe there's early onset dementia, different things like that. And I believe that is the model BC Housing has agreed, Vancouver Coastal Health has agreed. I know Susan, we're kind of in the same boat, and it's the model that needs to be between independent housing and assisted living. And instead of uprooting seniors and moving them somewhere, we're actually able to keep them at home, to age well at home if that's the right place for them, just with those support systems in place. And again, often that almost looks like a very involved family member. So for me, if my grandmother who lives down the street is struggling, she's able to call me, I can pick her up groceries or I can check in on her. I notice if she's getting sick. Many of the seniors that we work with don't have somebody like that in their lives. And so we become like that alternate family member, and we're able to advocate on their behalf. We work in partnership with the landlord. We don't advocate against the landlord. So we work together, because of course that would be a conflict of interest. And our goal is to help keep people housed, which obviously nonprofit housing providers have the same goal. If it's no longer appropriate housing, we walk that journey with the resident, and we are able to apply for assisted living or long-term care, whatever the case may be for them, but so that they're not slipping through the cracks. Often it's far too late, and obviously we're seeing a huge rise in our seniors homelessness. So yeah, absolutely. I believe it's the only solution for our future of our seniors to not see more homelessness. I mean, 24% of our homeless population in Vancouver, in Metro Vancouver, are seniors. So that's pretty shocking that we've even allowed that to happen. And we're just scratching the surface of our baby boomers coming to an age where they need support services. So
yeah, I couldn't agree with you more, Jenny. And I'm really fortunate in that I've just started with Brightside Community Homes Foundation, and that is certainly the philosophy that they're approaching that ongoing resident support with, and that's actually my role now, is to help improve the social determinants of health and those outcomes by providing greater supports to residents who are in need, and really looking at that model of being able to age in the right place, age safely in the right place. And how do we as landlords have that opportunity to provide greater services without overstepping the boundaries, but really try to mitigate the risk to those residents who may be struggling to live independently. And again, for anyone who's interested in collaborating or looking at how we as a sector are able to approach some of these questions, would love to hear from you. Absolutely.
That's awesome. Thanks again. Maybe just one more question here. Well, I'll do two. One of them is kind of simpler, and it's directed to Jenny. You mentioned positive posters throughout your presentation. Where can they be found online? Are they available online?
We just made ours, so I'm happy I could share those with you, Jackson. Would you be able to add them to the presentation?
Absolutely.
Yeah, okay, I can post those for you. And yeah, we just made them ourselves. We would take what was sent to us by PC Housing or by the healthcare, and then we would still post those, but we would really take the ones that that applied and created them.
Great, thank you. And for our last question here, it's is there an excuse me, wrong question. Thinking about transitioning into the recovery period, how do you think the withdrawal of a lot of these pandemic response services will impact the seniors community? And will this pose a problem? And are there any kind of strategies to address that moving forward?
Yeah, it's a really great question. It's something we've thought about from before we even started to provide the meals. We thought about what about when the meals end. And so throughout, one thing that we've just continued to do is talk about it. So as we're delivering meals, letting people know that this is during the time of the pandemic. We're really glad to be able to provide meals during COVID-19. So just creating that expectation that this isn't forever, and hopefully it helps them to save up a little bit or put some aside for the future. But I hope that there will be a balance of the reintroduction of the things that they love, and then that can help us to transition away from some of the things that they may lose. However, I do believe there are some things that should stay in place that should have been there all along. And so I hope that as, even as BC and PHA as a collective, that we're able to voice that and really be that voice for the people that we represent and the people that we work with, and to say, this is what we're hearing. We're hearing that this has been extremely helpful. My health, we got a note, somebody actually called me, and I've received letters as well. Somebody wrote us a note to say that he's struggled with his digestive issues for years, and having these meals brought to him has helped him get his appetite back. And so little things like that, I think it's important to know that many people were struggling before this pandemic. I think all of us were preaching to the choir here. We all know that. And so taking away from this, what can we continue on and what can we really take to our funders, take to us as an organization, and say these are the things that we really need to keep, because this had nothing to do with the pandemic. This was a need anyways.
Ditto. Ditto. I think just based on my experience with some of the funders and the funding that's been coming in for that frontline service provision, it is very time specific or circumstance specific. That was a mouthful. I am concerned about what's going to happen for people once the funding runs out. We rely on funding in order to be able to provide services, to be able to provide value added services to those who are in need. And like Jenny was saying, you know, people are starting to get better now that they have access to something like regular meals. Imagine that. We've seen that happen in hospices and hospices, for example, run by the Bloom Group in the downtown east side, where people are terminal and they go into hospice and they recover because they're actually getting meals and they're getting the support that they need in order to thrive, to have that quality of life. I think it's going to take a real shift in how we as a sector start demanding that support and start breaking down some of the silos that were set up for us based on funding structures and, you know, things like that, and really working collaboratively to be able to affect change at a societal level.
And one other thing I would add to that, I think if this could be like our pilot project, our proof model right now, as a sector, I would say, and this is my own little soapbox, but if we do this really well right now, I don't see them being able to take that away. And because the seniors are finally in the limelight, are receiving the attention that they deserve, I think as a sector, for those of us who house and care for seniors, being careful not to misuse the funding we're getting, but really showing evidence of how effective it can be. Because I think there is a danger when all of this funding is coming in, and if we're blowing it, for lack of a better term, but really using it, finding things that are effective, not just today, but can have impact in the longer term as well, and being creative about that. And really, for me, I take that to heart as a big responsibility. Are we using this funding well? We all pay taxes. This is all of us together. And I think it's so important that we are able at the end of this to show the evidence. This is what we can do with that funding. This is what we were able to accomplish. And this is the data. And not only that, here are the changed lives. Here are the healthier seniors. Here are the people actually receiving the care that they need. And here's all of us preventing homelessness at the end of the day, providing care and housing for very vulnerable seniors. So that's my soapbox. I hope that we all do a really good job with it, because if we can work together, and that's one thing I love about BC and PHA, is that it helps us to work together and pool our resources and say, how are you doing this? How are you doing that? Let me help you with this. Let me show you how we did that, or vice versa. I think it's a brilliant way to show the government or the funders how this works together and how we actually can make an impact that's long lasting. Because I think that's what everybody wants to see, are results that actually work. So
I love that you said that. Yeah, that whole data tracking and looking at the outcomes. And if you already have benchmarks established, you know the demographic that you're serving, start doing comparisons. What are the outcomes of this additional funding? Those are the things. And if we're tracking it both as quantitative and qualitative data, we're able to create a really well-rounded image of what's happening in the sector and where we can have true impact, positive impact. You know, those stories of change, as well as looking at, you know, are we seeing a reduction in the number of times we're needing to call 911 for our tenants? Are we seeing a reduction in the number of deaths, for example, that are occurring within our buildings? You know, whatever it is that we're seeing on a regular basis, how are we seeing that affected by the additional supports that have been put in place?
Yeah,
Well, let me just say,
Amen.
let me just once again say thank you. That was truly an excellent and inspiring and informative presentation, and we really appreciate it, and we appreciate your time. I'd also like to thank all of our attendees for your great questions and for your time as well. As I mentioned earlier, we will be sending this link to the recording and the visual recording piece as well to all participants within the next few days, and Jenny will communicate about maybe getting some posters out to folks, some positive posters out to folks as well. Again, the recording will be hosted on the BCNPHA website at bcnpha.ca/education/webinars. And for more COVID-19 resources and upcoming education webinars, please visit the BCNPHA homepage at www.bcnpha.ca. Thanks again, and take care, everybody.